Harkins, Hickman, Hill, Hobson, McMahon, Tate, Turner Ford, Wiggins. We have a quorum.
The first item on the agenda is House Bill 431. This is another one of the, in fact, technical amendment bills that we're running. There was a provision from the existing code that inadvertently was repealed in some legislation that we passed last year. What this bill does, the language that is underlined on lines 94 and 104 is the language that was inadvertently omitted, that inadvertently got repealed in last year's bill. I think it would be well to have an amendment to make the bill effective from and after passage, since what we're doing is trying to correct an error. So if someone will move title sufficient do pass, and then someone will move to amend the effective date, I would recognize someone for that. The secretary himself has made those motions. Let's take up the effective date clause. The motions to amend the bill by changing the effective date to from and after passage. If you're in favor of that, say aye. Opposed, no. The ayes have it. Now back on the bill. Are there questions or debate on the bill? If not, Senator Johnson moves title sufficient do pass as amended. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2394 deals with cottage foods, and I would entertain an amendment to this in a moment. Senator Johnson moves title sufficient do pass just to get the bill before us. Several years back, we had a bill dealing with cottage foods, people who basically cooked in their kitchen and sold small amounts of food. The original dollar cap was $20,000. The existing cap is $35,000. This bill would extend the cap to $120,000, which seems to me a bit more than we should bite off. The other thing that the bill does is require some specific training from food handlers. I think, and I would suggest, for what it's worth, increasing the dollar amount to $70,000, which would, as I understand it, double existing law, unless I'm looking at it wrong in the code. And let us see if we want to have perhaps an intermediary or in-between group for larger operations. But this is a bill by Senator Seymour and others, which, as I say, requires, first of all, it makes explicit some items that are for sale. I don't know that that's exactly a change in existing law, but it certainly helps to have something like that written into the code so somebody can look and say that I'm making fried pies and fried pies is on the list, so clearly I'm covered. I think that's useful, and I think it's also useful to get some sort of food handler training, which is required. And I know that Senator Hill had another bill on the same topic, but Senator Hill also co-authored this bill. So, Senator Hill.
I did co-author this bill, but I'm noticing something in this bill that was not in the original bill. I'm looking at the training that it talks about. We did not require any type of training or serve safe or any inspection to have a serve safe or any type of training in the original bill. And I don't know that bringing training in now is going to make it less cumbersome. It looks like it might make it more cumbersome to have to go get some type of certificate now where we never had to in the past. I think the goal was to take the income cap off, and I didn't anticipate having more training in here that had not been in the original bill.
Yes, the requirement for training is new, and the provision that includes beer and wine is new.
Mhm.
And the listing of specific items I think is existing law, but it's new to the code. The difficulty is that at some point, operations get larger and larger, and there is a larger public health issue. For example, if there's a bad batch or something that goes out, which can happen anywhere, one would want to be able to trace that back to the point of origin.
Well, they still can, because the original bill requires labeling to where it came from. It required a list of a list of ingredients and any type of allergens. And it was a specific label that was required in the original bill.
When you say the original bill, you're talking about existing law.
I'm talking about existing law in 2013. Yeah, there was a labeling requirement that you had already in the existing bill, the existing law. So I'm trying to look and see in Senator Seymour's bill. I wished I'd known his was coming up instead of mine, because I would have been a little bit more prepared for his. But
You've seen the number of co-authors on his.
yeah, yeah. And I'm for adding the wine and the beer in it. I want to make sure that we're not making it any more cumbersome than it was. And I don't see any certificate listed in here. It just saying follow certain federal guidelines for safe food handling. So, I mean, we might can just look at that a little bit more on the floor if you want to go ahead and advance the bill.
Okay, I think the line
Oh, no,
requires,
there's a test in here. There's a test, they're adding a test in here, a food handler certificate. This is defeating the whole purpose of being a cottage food handler. I mean, that the whole purpose of the cottage food bill to begin with was to forego this stuff. Because if you're doing all this, you're doing the same thing that a retail establishment has to do. So, I mean, we're basically deleting what a cottage food is, because it doesn't require all this training and certificates and testing.
unless I'm mistaken, there's a pretty vast difference between what this bill would do and the restrictions that larger food sellers are under. The requirement that's in the bill that everyone authored would simply say that you had to get training about
Okay.
what was and wasn't safe. And
Well, I'm going to ask for unanimous consent after I've looked at this bill to take my name off if it advances, because I think this destroys the cottage food bill that I passed in 2013. I think it turns it into basically a regulated business, and that's not what the intent was.
okay, well, the bill is before the committee. Senator Hobson.
Question, Mr. President, Mr. Chairman, excuse me. Am I recognized for a question?
Yes, sir.
What would be required for someone to get certification or take a training course? Do we know? How difficult is it to get this done?
I had assumed, based on my conversation with Senator Seymour this morning, that there was nothing burdensome in the bill, and that would be some sort of training that would be relatively inexpensive, or if not free. I did not ask Senator Seymour that question.
Thank you.
Well, what is the pleasure of the committee? Senator McMahon.
My motion is we lay it on the table, subject to call the chair.
Okay, Senator McMahon moves to table, subject to call. Are you ready to vote? All in favor, say aye. Opposed, no. The ayes appear to have it. The ayes have it. Senate Bill 2441 is dealing with medical licenses, and I think Senator Boyd is prepared to discuss that with us.
This bill is a bill that's designed to help the physician deserts that we have in our state by looking at some of our current laws and expanding them. So under current Mississippi law, the State Board of Medical Licensure may grant a limited institutional license to graduates of foreign medical schools approved by the recognized credentialing organizations for practice within state institutions. And these are typically valid for up to 5 years. What this bill does in the beginning sections, it changes that from 5 to 8 years and authorizes the board to issue such license based on application and satisfaction of all board requirements. The board may waive the 8-year limitation in its discretion. And why that matters is it extends the institutional license period provided, so more time for foreign trained physicians to practice in Mississippi state institutions while they complete regular licensure requirements, potentially increasing physician availability within state-run care settings. Then in the next part of the bill, their current law has no explicit limited licensure category. Currently exists for internationally trained physicians with offers of employment in Mississippi. What this does is it creates a new category of limited licenses for internationally trained physicians who meet criteria, including they have to be an MD or a DO from an accredited program. They have to have a valid medical license in another country without any disciplinary actions. They have to have English proficiency. They have to be federally authorized to work in the United States. They have to have 5 years of postgraduate medical practice. This limited license is valid for 1 year and may be renewed up to 3 times if the holder has passed the first 2 steps of the USMLE and holds certification from the Educational Commission for Foreign Medical Graduates. Licensees may practice only in rural, medically underserved, or physician shortages areas. The board may grant an unrestricted license after 2 years of practice and completion of all USMLE steps for eligible holders. What this does is it aims to recruit experienced international physicians to serve in underserved areas in Mississippi, increasing physician capacity where shortages are the most severe while maintaining full pathways to full licensure. The last part of the bill, what it does is we do not currently authorize a limited license category for U.S. medical school graduates who initially fail to match in the match program with a postgraduate residency. So what this does, it establishes a limited license for U.S. medical school graduates who are Mississippi residents and U.S. citizens or legal residents. They have to have graduated from an accredited U.S. medical school within 2 years. They have to pass steps 1 and 2 of the USMLE. They have not enrolled in any resident program yet. These licensees must enter a supervisory practice agreement with a fully licensed physician and may only practice in counties with populations over 100,000. Supervising physicians are responsible for oversight, and the licensees must disclose their limited status before providing care to any patient. What this does is it allows newly educated physicians who did not place into the residency match program to begin practice under supervision in rural or smaller communities, aiming to address physician shortages and build local workforce capacity. Additionally, a couple other things in here is the board may issue unrestricted licenses to internationally trained physicians who meet specified criteria, or those licenses licensed in other states that have clean records and no disciplinary actions. The bill sets up supervisory requirements and geographic practice limits for limited licensure holders to ensure patient safety and targeted workforce deployment. Medical graduate limited licenses must disclose their status before delivering care. overall, what this bill does, it's extended to expand and modernize our physician licensure framework by lengthening institutional license terms for foreign medical graduates, creating a structured pathway for internationally trained physicians to practice in underserved areas, offering supervised practice opportunities for U.S. medical school graduates who did not match in their residency. And hopefully these changes can help improve healthcare in our rural and underserved communities by supporting physician workforce growth and align licensure pathways with the modern needs. That's an explanation of the bill, Mr. Chairman.
Are there questions? Senator Hickman.
Just a question for clarification. What's the difference between the limited institutional license and the limited license for internationally trained physicians?
Right now, there is no explicit limited license category for internationally trained physicians. This would put a licensure process in place for those internationally trained physicians. So right now, there's under current law, there is no limited license category for that.
So does section 2 just extend that 5 years to 8 years, and then section, I'm guessing 3 actually defines what it is? And the reason I was asking these questions, I haven't had time to look through this, but it seems like the timelines were kind of maybe not lining up, because I think it says that they're licensed in this section where maybe for a year and they can only renew it 3 times, but we give them 8 years of practice. And I was just trying to figure out if they were the same thing. I'm not, these are all for clarification.
I understand. So section 1, what it does is increase it for that is for limited institutional licenses where the state board of, so let's go back and talk about what that is. For limited institutional licenses, the State Board of Medical Licensure can grant a limited institutional license to graduates of foreign medical schools approved by recognizing their credentials. Those are typically valid for 5 to 8 years. What this does in this bill for those individuals, it increases it from 5 to 8 years. And this specifically applies to physicians in Mississippi State institutions. Then the second section is what this does, it creates a new category of limited licenses for internationally trained physicians that have to meet the following criteria. And those are not limited to state institutions. Those could be to go to underserved areas where there is physician shortages. So first section, state institutions. Second section has to do with physician shortage areas.
Okay.
And just to also tell this too is 30 states have already passed information like this. I know I went to a public health meeting a number of years ago with NCSL, and Minnesota had great success with this and was promoting that this has been very effective in trying to get foreign trained doctors to particularly those underserved rural areas.
Senator Hobson.
Thank you, Mr. Chair. All right, in one part, the licenses could be waived, or it could be moved from 5 to 8 years. But then there was another statement you made in the initial part that said that could be waived, the 8 years could be waived. Is that correct? Why would you want to waive, if you're extending it from 5 to 8 years, why would you want to go ahead and waive the 8, and then in the same part waive the 8-year requirement?
I think what they're trying to do with this section is they are trying to give the board discretion. If this has been a good actor, they've been helpful in these state institutions, it's give them some more extended time to practice in those areas. So I think, and also too, they should be in the process of completing all things that they need to do. So maybe there was a hang up, maybe there was COVID, maybe there was something along those lines. And this would just give them the ability to provide one of those additional extensions.
just seems like if they had 8 years to get licensed, that'd be plenty of time to get a license, and they ought to be able to go through whatever hoops are necessary to get it in 8 years. I thought extending it from 5 to 8, still, I thought actually 5 was probably fine, frankly, but then going 5 to 8 is plenty. But then if you're waiving the 8, so they would never have to get a license, the traditional form of a license.
Yeah, I do.
Is that how that works?
Well, I don't think that would ever be the case. I think this would probably be an extenuating circumstances along those. I know other states have done this, and it's very similar to the language kind of that's been done in other states, just kind of in norming this, what they typically do in this regards.
Okay, yeah, maybe I can talk to Ken or somebody at the Board of Medical Licensure to
Yeah.
give me a little bit more input on that. And then the other part was the 1 year, well, I think Senator Hickman touched on that, but I think that's a different kind of license where they can get the 1 year, continual 1 year add-ons, right?
So the additional 1 year has to do with individuals who did not match in their traditional match day that
Okay.
you're very familiar with.
So that didn't have to do with that second, were there 3 categories?
There's 3 different categories
Okay, I
in this
thought that
bill.
was the second category.
The second category had to do, again, with internationally trained physicians. And so there's not a limited license right now for those internationally trained physicians. And what that's doing is giving a limited license, but they can only go to work in those limited licenses instead of working in a state supported facility. These are
Right.
limited licenses in the rural areas that would go to the underserved or physician shortage area.
Okay. But,
That's the way I'm understanding this.
and they would still have to come back unless they get exempted every year to make sure they're doing what they're supposed to be doing. Okay. And then, so there was the third category, as I understood it, which was the graduate that didn't match. And in that case, as I appreciate it, you said something in the explanation that they've got to be in an area with a population of in excess of 100,000, but then the idea is to take them to rural areas. That didn't, I'm having a hard time reconciling it if they had to.
1,000, I'm
Oh,
sorry.
I thought you said they had to be more than 100,000.
Apologies.
So they have to be in they have to be under the supervision of a physician there, and they have to be in a county of less than 100,000. Why wouldn't we limit it to even smaller? I mean, you could have a 80,000 person county, and that's not rural in Mississippi. I mean, it seems like we'd be in places like 20,000 or at least under 40 or 50. Am I?
Senator Hobson, I don't have any qualms with that. If the committee so feels that way.
Maybe I'm missing something and somebody else can explain a reason, but
I think Senator Hobson too, though, and you know this, you can have an underserved area in 100,000 county because they might not want to be in that parts of that particular area. So I think you can still have some areas that are not serviced even in larger places.
yeah, I know what you're saying, but I just they're maybe 10 or 15 minutes away and they could get to the place where the person is. We had the same issue with rural physicians, and I remember talking to them about this, and we saw physicians go into communities that are not rural in Mississippi. And it's very frustrating to me when we have a lot of places in Mississippi that do, as you started off saying, that are deserts. And then we got physicians, I won't pick on any particular town. They were going to towns that are plenty capable of attracting and have numerous physicians. If the idea is really to get in the rural areas, I think it ought to be in a county of, and I'm spitballing. I'll be happy to entertain other thoughts and ideas, but something around 20 or 25,000. Senator Boyd. And,
I think that would be
happy to hear from other persons. And Mr. Chair,
that would be a friendly amendment, I think.
maybe put a reverse repealer for now, and we can talk about this more because I'm not married to any particular number. I just think it deserves.
Senator
something
Blunt
different.
is seeking recognition.
Yes.
So what I'd like to do is recognize him and then come back to
Thank
you when we finish for whatever motion you think is appropriate.
Thank you.
But I would suggest this to the committee just to think about. I've spent a lot of time worrying about how to define rural counties and super rural counties and on and on and on. And one of the things that takes place that I think people don't realize is that counties are quite different. And we tend to think of a county as a county which has one major city, which is the county seat, which is somewhere close to the geographical center of the county. And then the county is surrounded by the by its trade territory. Pontotoc County comes to mind as an example of that. I think probably Union also, where you have the county seat, which is the one and only major city in the county, and then the surrounding area. But you also have counties that vary greatly in terms of area, and that can affect population also. And so it struck me that maybe a useful definition, if you're trying to identify a rural county, would be a county with no municipality or no portion of a municipality whose population exceeds 10,000. In other words, I don't know what the population of Sunflower County is, but Sunflower County's got some more bodies simply because it's a huge county. But I still think by any definition, Sunflower is rural, and probably in fact more rural than some counties with smaller populations. But we're at this point in the debate and having the chance to ramble. I've chosen to do so. Senator Blunt would like to get us back on the bill and ask a question about the bill.
Well, Senator Hobson, Senator Brown, thank you, Mr. Chairman. You've given me some more things to think about since I initially was reading this. I'm trying to deal with two different aspects of the bill. One, I think, is that it's attempting to direct physicians into a certain area of the state. And I'm all for getting physicians from anywhere, any country to come here if they're qualified and under the supervision of the Board of Medical Licensure. I'm all for making it easier for doctors to come to Mississippi. But you've got one part of the bill that is sort of saying, well, you can come, but you can only come if you go to these places. And then I worry that that we're creating, are we setting up two different standards of care for people who live in one part of the state versus a different part of the state? And I'm, I want to make it easier for people to come here. I know we need to provide incentives for our underserved areas, but I want to make sure that we've got that people in rural areas have the same quality of physician as people in non-rural areas. And that's just, I don't know the answer to my question, but I just wanted to raise that and hear what you think, Senator Boyd. Thank you.
That's a question that I asked when I was asked to explain the bill, because I think you bring up a very valid point. However, when I looked through the criteria here that is required, we actually may have a higher trained physician in our rural parts than we do coming out of graduate school. If you look through here again, and that's kind of why I drilled those off, and I drilled off a lot, and I apologize to the committee, but you have to have an MD or DO degree. You have to have valid medical license in another country without disciplinary action. You have to have English proficiency. You have to have authorization to work here, but you have to have 5 years of postgraduate medical practice. And that's a much larger amount than you typically see with some of our graduates that come straight out of medical school. So this 5-year criteria, I think, actually puts that we may actually see more qualified physicians that are coming into more of our populated areas.
Senator England.
Thank you, Mr. Chairman. I have a question. Senator Boyd, thank you for your explanation of this bill. I know that you're in part of the state that's been going through a lot here lately, and having you here to present a big bill like this is probably tougher than usual, but thank you for that. This bill, as I read it, it looks like it would maybe free up some residency slots for some of the students that are currently in med school. Is that true?
Absolutely. So one of the things that has to happen right now, if you come from a foreign country and you may have had 5-10 years of practice in that foreign country of postgraduate work, you have to go back and do another medical residency at a U.S. medical school. And so we have a lot of our residency slots that are taken by individuals who are having to, maybe they've been practicing for years, and they have to come back and do a full residency. By creating this additional pathway, we clear up residency spots so that we can bring those younger untrained physicians in and put them in those residency spots and go ahead and let these people who've been practicing for years and years, we can put them out into the workforce. And so, and I see that happen in my community with people that are in, we have a residency program in my area, and I see that happen over and over again. Wonderful doctors, they have an immense amount of experience, but they need to be practicing immediately.
Yes, I know we've also, in my area, we've had issues with, trying to create and broaden residency programs because they're so important. But thank you for this effort. I think that's a great thing that this does.
Senator Blackwell, welcome back. Good to see you. Would you like to ask Senator Boyd a question?
Thank you, Mr. Chairman. Yes, I would. What do other states do? Do they require their residency requirements for their out-of-country physicians?
Yes, sir. This is really modeled off about 30 states already have this in place. I'm not familiar with all 30 states, but this is very, very similar to other states. I have talked with physicians in other states, particularly in regards to like ER and rural areas. And they have enacted this legislation, and they found it to be highly effective, and especially putting physicians in those rural areas.
Anyone else? I promise to return to Senator Hobson. Senator Hobson.
Thank you, Mr. Chairman. After hearing the discussion, and so as not to limit it in any unusual ways, just I would offer 50,000 instead of 100,000 as the cap on the population. And that is a proposed amendment.
Do you understand the amendment? You ready to vote? All in favor say aye. Opposed, no. It appears the ayes have it. The ayes have it. Further debate on the bill? Senator Johnson moves title sufficient do pass as amended. All in favor say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it. Senator Blackwell, in honor of your return, the next bill is Senate Bill 2549, which you introduced. It's my understanding that what the bill does is make clear what is currently the practice involving what radiologist assistants are actually doing, the underlying language being on lines 25 to 32, and they're in lines 54 to 59. Would you like to add to that or discuss the bill further?
Thank you, Mr. Chairman. You're exactly right. This is existing law, and what we-
Senator Blackwell, it's all going to be downhill from your opening phrase. That's
easy.
we just pause for a moment and ruminate on that. Okay, go ahead, Senator Blackwell. Do I really like the beginning of it?
Thank you, Mr. Chairman. This, as the chairman said earlier, this is existing law. What we've done is took the opportunity to strengthen the part of as far as what requirements are needed for this position. And then right now, radiologist assistants can't communicate a preliminary diagnosis to any other practitioner. And that's certainly a detriment if you're in a small rural hospital. So all this does is allows them to communicate the preliminary report. It has to be marked preliminary, and then the radiologist has to give the final report. That's an explanation of the bill.
Are there questions for Senator Blackwell? Comments? Anyone? Senator Turner Ford.
Thank you, Mr. Chairman. At the point that a radiologist assistant can communicate a preliminary image interpretation report, is it in writing?
Generally, it's communicated through the phone.
And so it would not be at the point of service where the person's image has been taken and they're just having a conversation
No,
with the radiologist assistant?
It would be at that point of service where the image is taken, they look at the image, and they then communicate I guess with consultation with the radiologist, communicates that preliminary report.
So is the report given before the consultation with the radiologist?
No, ma'am, I would imagine that the way it should work is the radiologist assistant would have a conversation with the radiologist.
Thank you, Mr. Chairman.
Anyone else? Senator Hill?
I think I see where this is going. What it would amount to, Senator Blackwell, is if the radiology technologist who is taking the pictures sees something that they think that they need to communicate right then with that radiologist, this authorizes them to communicate what they are interpreting on that image and potentially call that radiologist in while that patient is still in the room for further evaluation. Is that what you're trying to accomplish?
It can be done that way. It can also be done with communicating with a referring physician who's not in the hospital or who's on staff of that hospital.
And he may need to order additional testing.
That's correct.
Okay, I've been in this situation before. And I think my people probably did it anyway. And I think it helped. So I think I support what you're doing.
Thank you, ma'am.
Senator England?
Thank you, Mr. Chairman. I have one question just to, and it's, I hope it's a simple question. Does the radiologist assistant, are they also, are they able to transfer the actual image to the other care physician as well? Because I know a lot of times when I've looked at this, the physician wants to see the images as well, so they can put that, but they'll just have their preliminary, their own image interpretation on that. Correct?
For the most part, these images are captured in what's called PACS, a picture archiving system. And so if you're on staff or you have privileges or you refer to a outpatient organization, you have access to those images of your patient and your patients only. But they would have real-time access to that, where if you wanted to communicate to urologist, for example, he could pull up the images and be looking at them also with the radiology assistant.
Further debate, questions? Senator Blackwell moves title sufficient do pass. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. The next item on the agenda is Senate Bill 2446. Senator Boyd, you and Senator Blackwell introduced this bill. Would you want to move title sufficient do pass and then explain to us what possessed you to introduce the bill?
Moves to title sufficient do
And,
pass.
and could you please speak right into the microphone, or perhaps even speak louder?
Okay.
Just incorporate, reference my previous remarks about the sound system.
Okay. That will be my motion at the appropriate time. This bill does two things. If you'll look on lines, 202 through 204, what this bill does is it requires you to register as a sex offender. If you have been, where commercial sex is involved, and this protects the general public through notification of their demonstrated propensity to perpetuate crime in vulnerable areas. So you would be required to register if you were convicted of that. If you're trafficking that. But what the other bill does, and this bill is brought to us by the Attorney General's office and their continued work with human trafficking. Through their work in human trafficking, and some of you have gone on the stings now or have been able to observe those processes that they've gone through. They know that oftentimes a person that's being trafficked has to go to the ER, the emergency room, and oftentimes it is the nurse who is going to see the person that's trafficked. And so this is repeatedly happens over and over again. And this, they want to make sure, and they have worked with the Board of Nursing, they have actually have the endorsement of the Board of Nursing to help make sure that nurses know how to do this and know what to do when they do it. They've have endorsed that the Board of Nursing will require training every 2 years when a nurse gets her license. They will have to certify and apply for, when they apply for their nursing license, they will have to make sure that they have done training in this particular issue. And the bill has been again endorsed by the Board of Nursing in this regard. So that's an explanation of the bill.
Senator Wiggins.
No, at this time, I don't move title sufficient to pass, but my question is, which is a question that I've asked others in other legislation, is why is human not that this is a laudable goal, but why is this any different or better or worse than, say, a child who's abused? Why are we not requiring every nurse to have training in detecting child abuse? Why is it? So I'm just wondering why we're elevating human trafficking, even though it's horrible, and we're putting another requirement on nurses that they have to do because of this. And then I'll say the companion question is, do nurses get training outside of statutes? In other words, do they have continuing nursing education? And why can't this be done in continuing nursing education? Why do we have to put it into a statute?
May I answer?
Yes, Senator Board, you're recognized to respond to the questions.
I think one of the things that we have to realize is, I talked about child abuse, child issues and stuff like that. Many of the people that are trafficked are children. It is oftentimes of a different nature. You don't see a physical bruise. It is something that you can look for signs to know this. And oftentimes nurses have received extensive training and looking for child abuse, for looking at other particular issues in their training in nursing school. Human trafficking is something that we've largely ignored for many, many years as society. It is something that has not been trained in most of their medical schools for a long number of years. So the nursing board obviously felt that this was an important thing, that they've endorsed this to do an additional hour of this. So I don't know that anybody's trying to elevate this beyond anything else, but it is something that needs to be included and wasn't something that was included for a long number of years in nurses training in medical school. So I think this is important, but I will tell you this too, Senator. When you go through one of these trainings, it heightens your ability to look for all kinds of issues because it always provides cross-training in those. And so for the nursing board to endorse this, I think it speaks volumes as to what the nurses think that they need to do in this arena.
Okay, is this bill coming from the nursing board, or is it coming from the Attorney General's office and the nursing board is saying, yeah, we're in favor of it?
Well, the Attorney General's office worked in collaboration. They went to the nursing board and said, what do you think about this? And the nursing board has indeed endorsed that. So I would say it was in collaboration very strongly with both entities working together.
We require extra nursing training for domestic violence victims who also suffer from mental trauma. And we constantly see domestic violence in our courts. And as far as I know, we don't require nurses to have that training.
Senator, I did not look over what is in particularly right now, the training in many of our our nurses' schools. We'll have to see what we can get for you with that. So I'm not sure about the answer to that and not going to attempt to try to answer that.
I guess, and just to kind of finish up, when nurses, doctors, they treat the patient as a whole, and patients come to them from all different backgrounds and all that. And it seems to me, and this, I may be the only one with this opinion, that we're elevating one type of issue above others when medical providers, including nurses, get training outside of statutory requirements and things like that. And I just don't understand why we're elevating one over the other. So that's me.
In response to that, I would say that this is not elevating. There are many things that nurses are trained with in their traditional trainings. This has not been one of them. And there is a need to provide that training now as we see increased cases of it, as we've been unaware of it. And so for many nurses who haven't been trained in this, this is in addition to the training that they've received. Obviously, the nursing board felt that this was something that they could support and they could endorse, to say that this is something that they were willing to have their members do.
Senator Hickman.
Thank you, Mr. Chairman. Yeah, I thank you for working on this and certainly appreciate the AG's office for their attention to these matters. I just have a couple of questions and maybe some concerns. Section 3, subsection C, I think. It talks about reporting. So as I read this, they're required to report to law enforcement, but then they're also required to call both state and national hotlines. Is that the way I'm reading this?
Yes, that's the way I read it.
And they don't list what hotlines. They just say, shall submit reports of suspected human trafficking to state and national hotlines. What's the duty there?
Senator, we have somebody from the AG's office who is available to answer questions on that. I would like them, if the chair is okay, to answer questions in regards to that.
Is there any further debate or questions?
Senator Hickman just asked a question that I would like the AG's office to answer, if that's
Oh, I'm
permissible.
sorry. Yes, indeed. I was occupied trying to read the actual language of the bill, but yes, please, if you don't mind, come up to the microphone and help us out.
Thank you, Mr. Chairman. And for those of you who don't know me, I'm Abby Overby with the Attorney General's office. Senator, your question, and it looks like we should have specified there, the intent is that this would be reported to the state and national human trafficking hotlines. We don't explicitly say what those are. You might be familiar that Mississippi has recently adopted the Simply Report hotline as our state hotline. And in cross collaboration, as Senator Boyd talks about, we just want to make sure that all bases are covered. You might have noticed when it comes to adults, they don't always have to report. The victim has to consent to that, and before, because the victim may not want law enforcement to know. But if the national hotline knows, they can coordinate a victim services response. And so it's important to have both of those pieces if possible.
So I guess my question is, and my thing is, again, I think we've had some conversation, not about this bill. I hadn't specifically said that. I agree with the AG's work on this, but I think sometimes some of the things that the office has done becomes extremely onerous on individuals who happen to do these things. So I do think we probably need to define who they need to report to, because we're asking them, in my reading, we're asking them to report this to, at a minimum, 3 different places, but it just says like you state and national hotlines, and I don't know how many hotlines exist for sex trafficking. So that's one point. And then the next one, I'm not understanding like the end of the bill. They have definitions in the back of the bill, and then it has a lot of language about a lot of different agencies, which I don't think the meat of this bill, which it seemed to be one section, a simple bill, but then we pull out a lot of things, and I'm just not understanding why. I haven't had time to read line for line. If you could explain why we have all those things.
Well, the second, section 2 of the bill, Senator, is just the sex offender registration statute.
So there's already law.
Yes, sir.
Okay, perfect. That's what I needed to know. I just couldn't understand what was going on.
Yes, sir.
Looking at that. Yeah, I'd like to see some work on that section in particular, so we can curtail that. One final question. Who's offering trainings that, like, this required training right now? I'm guessing if a nurse is coming out of school, maybe schools would incorporate this or tell them where to get it from, but people who are having to renew every year, is the state or has the board agreed that they would provide this kind of training? Kind of like, lawyers, we have an ethics hour that we have to do every year that's required. Is it that type of situation?
Me answering that. So they would do this training every 2 years. They don't have to renew every year. So that's good. They have 2 years and it's just 1 hour. We have been working with the Board of Nursing, and the House, our House sponsor is a nurse. And so she's very intimately involved in this as well. The AG's office does human trafficking training for law enforcement, prosecutors. We've talked about providing the training virtually, because there are a number of nurses that will have to have this training. The Office of Training in Persons at the federal level, on their website, they have free trainings already available. And then they also offer tailored trainings. And so we could work with them to develop a virtual training for our nurses in Mississippi that's tailored to the issues that we're seeing in Mississippi. So these would be free trainings for them. There are conferences around the state and conventions that nurses attend already. Some of them, one recently just started a new human trafficking track. You might be familiar with One Loud Voice, the Children's Advocacy Centers. And so if they were to go through that training while they were there in attendance at that conference, the Board of Nursing could accept that. But we are looking for ways to make this easy, where it's not onerous, it's not overly burdensome, but it's something that, could be the difference between life and death and otherwise routine patient care.
And I think maybe, and if we can, I think we have you, I think maybe we can answer Senator Wiggins' question. Maybe if you have it, I had kind of the same question. How many units of training are they already required to renew? And is this just an addition, or does it replace something?
Currently, and that's something that we had worked with the Board of Nursing on, like many of us who are lawyers, we have CLEs. The Board of Nursing actually does not have continuing education, which was important to talk to the Board of Nursing about to get their endorsement on this bill and figuring out how to insert this training into what we thought would be an already existing framework. It wasn't, because they don't have continuing education. So this wouldn't fit into something like our ethics hour that we have to do. But we've had many conversations with them, and like Senator Boyd has said, they have found it to be important and endorsed the legislation.
Senator Wiggins.
Thank you, Mr. Chairman. Just to follow up on Senator Hickman, Senator Hickman's questions, Ashley, you said there are a number of nurses who would have to get this training. As I read section 3, it says every nurse under the purview of the Mississippi Board of Nursing. So what that says to me is that every single nurse in the state of Mississippi would have to get it. And so my question is, if you're a nurse and let's say you're a nurse who only works in the orthopedic surgery or something, why should that nurse be required to get human trafficking this training if they're, I wouldn't think an orthopedic nurse is going to need that. Am I wrong?
You want to?
the very places that these individuals could be come into, they come into usually with their, I don't know the official name of it, but the person who is trafficking them, they come into a facility with them. They may have broken an arm. They may have some type of other issue, but an orthopedic nurse would be ideal for somebody who should be trained in this because they're going to come in with broken bones or different things like that. The breadth of how these individuals come into the medical profession is pretty large. So, I mean, you're talking about 1 hour training every 2 years. I mean, this is not unduly burdensome.
Well, I understand, but if I understand what Ashley's, what's being said is that the nurses don't, for whatever reason, don't have a continuing education. And so now by this bill, should it pass, we are requiring a continuing education in this one area, which goes to my point about an elevation, even though the board / profession doesn't require continuing education. And I would think you would have a continuing education, a whole bunch of other stuff. So if this bill passes, then we're adding on 1 hour, yes, every 2 years of training that is not already there and that they don't have to do.
Yes, Senator, that is absolutely correct. And the Board of Nursing has endorsed and said that this is important. They feel like this is something that they are willing to do and have spoken on behalf of their membership that they feel like this is important. They don't agree with you that they don't agree with you on this. So
And that's fine. So every nurse in the state of Mississippi, no matter where they work, they're saying they want them to have this training, even if they're never going to work in a situation where this may come up.
yes.
Okay.
Further debate, Senator Turner Ford.
I have a question about, let's see, it's going to be at line 66, which says that this must be reported within 24 hours of the reasonable suspicion of human trafficking, and then going on to line 70, where it is a cause or potential cause of disciplinary action against the nurse if this is not reported.
Thank you, Senator Turner Ford. So yes, the requirement would be within 24 hours. That is because these situations are very critical and timely. You can imagine how quickly traffickers are moving. As to the disciplinary action, the board actually asked for this. We did not propose this legislation with any kind of disciplinary action in there. They asked how they were going to enforce it and asked if we could add some language in there that would allow them to basically, issue any kind of disciplinary action within their existing guidelines. There's not going to be revocation of licenses. We're not trying to take nurses out of the practice. We know there's a shortage. That's not the AG's intent at all. And like I said, we didn't have that in there to begin with, but the Board of Nursing asked for that.
And so according to the existing language, we really have no information about the magnitude of discipline that will be imposed. Is that correct?
It will be within the scope of the powers of the board that they have existing in state law and policies and procedures.
And so then this reminds me of the mandatory reporting that's associated with children. And I think that reporting is anonymous. And here, I don't see how that would be the case. Are there any concerns about the nurse perhaps violating privilege? Even if, and I'm thinking in terms of if it's an incorrect report. Because it's already been mentioned that some of these victims may not necessarily, the reason that you have this provision is because victims will want their information to remain private.
That would be for adults. The standards for children are in accordance with existing law, if I'm understanding your question.
Now, I guess the point is I would imagine if you want to make a report and you're identification has not been revealed, perhaps you're more comfortable making the report. But in this instance, the nurse may have some concerns or considerations about the privilege that exists with the patient. And so we're forcing the nurse to either make the report or subject him or herself to discipline when it just may not be a clear case of what's taking place.
Well, that would only, are you talking about in terms of adults, Senator?
Yes, I am.
That would only be in the case that the victim has given her consent. So, and then and the idea with the reporting here is so that law enforcement can provide services to the victim, and service providers can provide services, but the report can be anonymous and it can help law enforcement track human trafficking schemes. You know, we might have a victim here today and in Louisiana tomorrow. And if we can connect those dots, it can change lives. And so that's the idea with the reporting. If there's a question about privilege, I think, you know, the committee can handle that as they see fit.
Thank you, Mr. Chairman.
Senator Hobson.
Thank you, Mr. Chair. And some of these questions are similar to what has already been asked, but I may ask them in a different way. As it relates to the requirement to report, obviously in section B, you've got subject to the victim's consent. And then section C just says you have to report to the hotline. So which is it? Is this just not worded properly in the bill, or is this one of them requires you to get consent and the other one does not require you to get consent?
So consent would not be required in reporting to the hotline because those can be anonymous. And the language about reporting to law enforcement is taken from legislation that our Mississippi delegation at the federal level has worked on regarding the national hotline to make sure those carve-outs are there to make sure that victims have autonomy in that. But we believe that it's still important to report to the hotline so that victims can get services if they want them, and we can track some of those schemes.
How do you then know who the licensed nurse? I think this is what Senator Turnford was talking about. How do you know who it is that's reporting, and how can they be disciplined if it's an anonymous report to the hotline?
I don't have a good answer for that, Chairman. I'm sorry.
Okay. I do think it's not worded. I don't know, just see wording problems that can be, there's some gaps in here. One of the other things is it says that you have the relevant authorities and service providers. Who are relevant authorities and who are service providers?
Relevant law enforcement authorities, it looks like that was left in.
I don't know. That's why I'm asking who.
Yes, sir. That would be relevant law enforcement authorities, and service providers would be victim service providers.
Okay, maybe that needs to be specified too. And then as it relates to the hotlines, Senator Hickman was asking the question about the state and national hotlines. What if they're, maybe it's better just to go to state? That way you've got, are there any federal crimes here, or is this all state crime? I don't know the answer. Is this state criminal actions or federal too? It'd be federal too? Okay. Does it matter if we have one source? I mean, typically, I think in most instances, again, not a criminal lawyer, it seems like you've got one reporting duty to somebody instead of having to report to different groups. Would it be easier if we just reported to a state hotline, and then if they need to send it to feds, they can? Or do we have, you know, some group of national hotlines that they would go to? I don't know how that works really.
Mr. Chairman, given the concerns that people have over the reporting, some additional concerns have been raised over here. My inclination is that I'll offer an amendment at this time to strike lines 60 through 65 and take out those reporting requirements. I believe y'all can do that in your nurses training. And to take out this mandated of reporting requirements also too, because of concerns about HIPAA violations possibly and different things like that that have been raised. My suggestion would be to take out lines 60 through 65 at this time. That's my motion.
Senator Boyd moves we amend the bill by striking lines 60 through 65. Did I state that correctly? Is there debate on the amendment? If not, all in favor of the amendment, say aye.
Aye.
All opposed, no. The ayes appear to have it. The ayes have it. Senator Boyd.
Since we've adopted that amendment, I think then that necessitates that lines 70 and 74 are not applicable as far as discipline procedures. I know that they asked for that, but it seems to me that that's not applicable now since we don't have the mandatory reporting requirement to the hotline. So I would make a motion that we delete lines 70 through 74.
Senator Boyd moves we delete lines 70 through 74. Is there debate? There are questions? All in favor of the amendment, say aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes have it. Senator Boyd.
Can I ask another question, Mr. Chairman, before we?
Senator Barnett.
Thank you, Mr. Chairman. Thank you, Senator Boyd, for recognizing line 60 through 65. But my question is, why then is 66 through 69? Why does it still apply to this? And then I have to go back. Why does it still applies to this if those lines was taken out? That's one of the questions that I have.
I think that's an excellent point, Senator. I think we need to make a motion to take out lines 66 through 69. Clearly, I didn't read that close enough. So I think that's, I would make a motion at this time that we take out lines 66 through 69 as well.
Thank you.
Senator Boyd moves we delete lines 66 through 69.
I have no.
Debate or questions? Senator Barnett.
Thank you, Mr. Chairman. Senator Boyd, maybe when you struck line 60 through 70, through 69, maybe, and 70 through 74. My question goes back, I think, to what senators, I drew a blank on Briggs, yes, my question is on the, Senator Hobson and Senator Turner Ford asked the question and Senator Hickman about the reporting. The lines that you deleted, does that address those questions about reporting? And a specific question is that
as of now, we haven't voted on the amendment. Is this a question on the amendment?
Well, I just wait till after we vote on the amendment to ask the question.
I think it does answer those questions that they had about the reporting requirements.
Around it was to make sure that the individuals that was going to be doing the reporting was to make sure that what they're reporting was something that they thought was factual, so where an individual wouldn't have to prove that they wasn't actually acting in the engaging in human trafficking. So this would take care of that, correct?
Sir.
Thank you. Thank you, Mr. President. Thank you.
Anyone else? The vote recurs on Senator Boyd's amendment to strike lines 66 through 69. Are you ready to vote? All in favor say aye.
Aye.
Opposed, no. It appears the ayes have it. The ayes have it, and that amendment is adopted. And further questions or debate? If Senator Hickman.
Just a quick question. This is for clarification. What other circumstances, lines 58 and 59, what other circumstances would disclosure be required under law?
I think you're looking at rape or sexual assault, probably. which are, those are already required.
Anyone else? If there are no further questions or debate, the vote recurs on the motion title sufficient to pass committee sub. We ready to vote? All in favor say aye. All opposed, no. Ayes appear to have it. The ayes have it. Before I entertain a motion to rise and report, Senator Hill.
I was just going to tell you, I've had time to look at the Senator Seymour's cottage food bill, and I know what I need to fix. So if you, anytime you want to entertain it, this meeting or next meeting to bring it back off the table, I'm ready, so.
Okay. Let's just wait till next time. Reviewing the committee, I think it's significant that, as you remember, Senator Blackwell said that I was exactly right. And you may have missed the comment by Senator Wiggins, but he said at one point it was okay for people to disagree with him. So is there now a motion to rise and report? All in favor say aye, all opposed, no, the ayes have it.